Hey guys, so I just want to check in with you really quick. Sorry I kind of skipped last week. I'm actually in the middle of my finals week and I have an extra day today, so I thought I would film really quick and make sure I get something uploaded for you guys. I actually just got home from taking my intro to mechanical ventilation written final and then the lab final, which was super fun. I don't know how I feel about it right now. I guess I'll find out next week. But starting next week, I'll actually be going into my critical care rotation. So I thought I would show you some of the stuff that I'm going to take with me. And then if you guys have any suggestions of anything you think I might be missing or anything of the sort, definitely let me know down below. So first thing first, I always show you guys this, but I'll just include it in case you guys haven't seen it. So it's my Littmann Lightweight 3M, or Littmann 3M Lightweight, whatever you want to call it. It's my stethoscope. So it's really light, it's easy to use, it's got a bell and a diaphragm, and then you just turn it front enough, so make sure you always tap. And it's relatively affordable also, which is nice. Since I'm in school, I can't afford a $150, $200 stethoscope. And then of course I also have a pulse ox. Last time I showed you guys a lake face one, but unfortunately that one is no longer working, or I just need to replace the batteries for it. But one of my classmates had an extra pulse ox, so they actually gave this to me. So it's from Santa Medical. Relatively easy, you just start it and then put the bad boy on, wait for a second. It might be reading a little funny since I'm holding it. But you've got your SpO2 and your heart rate, and you actually have your waveform down here also, which is nice. So on top of that, funny story. So I'm going into my critical care rotation. I thought I would need a pair of shears because I'll primarily be in ICU, maybe ER, trauma, depending on where I get sent. So I was on Amazon, ordered a pair of shears, and wasn't sure the normal size to get. So I just ordered one that had decent reviews. These things are huge. Now, I don't have a clip or anything to put them on, so I'll be having to walk around with these. Now, I know that they do come with ones that are foldable and smaller, but I can't get another pair, so I will be stuck with these monsters. As long as they get the job done, though, that's fine. As always, I've got my little mini notebooks to write down if I have questions or want to make notes of something. So I also got a pack of pens. There were more of these, but I used them. So I think it was like 3 or 4 of these in a pack for $1, and then I actually got this for like 60 cents on sale. So I just grabbed a bunch of them to have extras because pens just, they walk away and go missing. And same thing, I'll have a couple of Sharpies in my bag for labeling whatever I need to, because a lot of times you either have to label nebulizers if there's a different type of medication in one that can't be mixed, or patient bags, things like that, so it's good to have a Sharpie. I have a calculator since I will be doing lots of stuff with vents, hopefully. And just in case, it's always better to double check rather than try to come up with some crazy value. Sorry guys, I'm a little bit like wonky because like I said, I just got done with both those finals. It took me almost 4 hours, so I'm a little sleepy on top of all of that. So please excuse all of this. So next thing, I know I have shown you guys both of these books before. My last rotation, I was primarily on the floor, IMC, I got to go to ER a couple of times. So I ended up taking Oaks with me most of the time because it's easier to fit in my pocket, and I wasn't doing a lot with mechanical ventilation, and there's no mechanical vent section in this Oaks book. They have a whole separate book for mechanical ventilation if you want to get that. But I do have my respiratory notes. I think I'll probably take this one with me this time. Although it is a little bit thicker, it does have a full section for mechanical ventilation if I have questions and want to pull something out of my pocket really quick. And then next thing I want to bring up, because I don't think I talked about this the last time I made one of these videos because I hadn't gone to clinical before, so I didn't really know everything I would need. And I did bring a lot of this stuff with me, I just didn't mention it in the last video, but this is good to think about, especially depending on how your rotations are set up. I'll be doing 3 12-hour shifts a week, and then I'll have a lab day every week also. So a 12-hour shift is a long time. You're gonna, eat a couple of times, hopefully, if there's time, and you're gonna be washing your hands constantly because you're washing or gelling every time you enter or leave a room. So one thing I recommend is bringing some type of lotion. I just have a random lotion that someone gave me called Delectable. But anything will work, preferably something that's not heavily scented, because you know you will be dealing with patients, but it will be a lifesaver because you're washing and gelling your hands so much, your hands and nails might start to split. So find your favorite lotion in like a small package and take it with you. It'll be a lifesaver. Also, same thing, chapstick, mints, gum, whatever you're able to do is going to be a lifesaver. There are going to be very busy days where you can't stop and drink as much water as you might normally or eat as much as you might normally. So that's going to kind of save you from having a dry mouth and getting that lovely bad breath that comes along with having not eaten in too long. So it'll kind of just save you from that, make you more comfortable so that when you're talking to people, you're not sitting there with a dry mouth or worrying if you have bad breath, something of the sort. And speaking of bad breath, I recommend everybody to get like a little travel toothbrush and toothpaste, because same thing, you're going to be eating, you need to brush your teeth, you don't want to go up to someone, start talking to them, and you've had, I don't know, like onion and garlic spaghetti or something for lunch, whatever you're into for lunch, and it'll just help you out. So it's just little things like that that do make a difference. All of this I'll probably be bringing in my backpack. I think that's it, really. I mean, you know, I've got my watch, that's it. So I will try to make videos for you guys occasionally. If you have any questions about what's going on in my clinical or anything of the sort, or if you have questions before you go to your first clinical, leave any comments or questions you may have in the comments down below. And then I'm not sure how frequently I'll be able to post while I'm on clinical, because it is a little bit more hectic. I'll be doing the 12 shifts, and then I'll have case studies and a presentation that I'll have to do at the end on one of my case studies. So make sure you're following me on Instagram. I'm usually posting what I'm doing or thoughts throughout the day. And if you guys do want to do that, I have a link in the description box down below, and I'm just breatheeasy_SRT on Instagram, so you can find me pretty easily. Alright guys, so I guess that's it. Again, sorry guys, I'm a little bit out of it just from finals week. I just want to show you a couple of things that I'm doing quickly, or can't even talk. I just want to show you guys a couple of things that I'm going to be taking with me quickly. Again, if there's anything you think I'm missing, leave a comment down below. Let me know so I can grab it before clinical start next week, hopefully. And I will talk to you guys later. Clinical at my... It's my... Oh Lord, very busy day.